Welcome back. Like we mentioned before the break, Dr. Christie Alexander with FSU's College of Medicine is live on the phone now with us to answer more of our coronavirus-related questions.
We always love when she comes on. She gives us so much great information. Dr. Alexander, thank you so much for joining us this afternoon. Tell us a little bit about what you are hearing on the front lines. You're there day after day. What's happening in Florida? Are we seeing any new trends or any new developments when it comes to coronavirus or even things that may help aid us to get better?
This is a great question, as always. I actually checked in with some of my colleagues in the Clearwater area, the Fort Myers area, Daytona, Orlando. And across the board, they all said that their COVID admissions have gone down over the past few days.
Oh, good.
Some even said they're seeing fewer cases, just like we were just talking about here in our area, and a downward trend in just capacity in general. So everybody's got their fingers crossed that this is a good sign, but it's a wonderful thing to go into the weekend with for sure.
Absolutely. We're all looking for that good news whenever and wherever we can find it. Of course, every parent in the country thinking about schools returning to the classroom, for many getting ready to reopen as soon as this Monday. Locally, we're seeing districts planning to reopen. A lot of debate, of course, on how safe that will be. But if parents want or just simply need to send their kids back to that brick and mortar classroom, what are the key steps, Dr. Christie, that they can take to keep them safe?
This is a fabulous question because you're absolutely right. As a family physician, we're getting asked this all the time by our parents, even by our friends, just everybody around us. This is the hot topic. The first thing that parents can do in talking to their children is just use something simple like the 3 W's. Tell your children to wear their mask, wash their hands, and watch their distance. So for kiddos that can remember things like mnemonics and things like that, this can be helpful, the 3 W's. Now, in regards to mask wearing, this is a good time, if you haven't done it already, to get your kids used to wearing a mask. And for any age, let the child pick out their own mask because they'll be more likely to wear it. Let them decorate it with stickers or whatnot if that will help. And actually let them practice putting it on their stuffed animals or their dolls to learn how to wear the mask regularly and efficiently. So those are some little pointers to get the kids engaged. I've heard some of my friends across the state with young children say that this has worked really, really well with their kids. And then in addition to that, just talk to them about why it's important. Why are we doing these things? Explain that there's something going around. We want to keep everybody safe and keep people from getting sick. And then in addition to that, just making sure, too, that you're caught up on your well child checks, your immunizations, things like that, to make sure they're safe as they enter the school. And lastly, I'll say for the teenagers out there who may be reluctant to wear a mask or socially distance or things like this, is to tell them, look, a lot of the teenagers, what I'm hearing is that they want to go back to school. They want to get back to the norm. And remind them that in order to stay that way, they're going to have to stay well, and everybody around them will have to stay well, which means wearing a mask, washing your hands, and watching your distance. So those are some pointers for all age groups across the board. And then for you parents out there, just be ready for those quick changes. If a classroom comes down with an exposure, you may have to quarantine your child for 2 weeks. Just be ready for those quick changes and have a backup plan ready if that should happen.
That was great advice right there. I know my niece and nephew are kind of doing that. They're starting to wear the masks before they head back to school. Well, there was a story the other day that Ohio's governor tested positive for COVID-19, and then just a few hours later, he tested negative. And so there are so many different tests that people can get for COVID. They're going, well, how can that happen? What test do I need to be doing that is going to be the most accurate?
This is an excellent question because it is extremely confusing, especially when starting with a positive test and then turning around and getting a negative test. So the most accurate test that we have right now is the molecular test, which checks and tests for COVID's genetic material, specific genetic sequencing. The only downside of this test is that it takes a little while to get back. So you don't get the results as quickly, but it is highly accurate and the one that we want to use the most often because it's so accurate. The antigen test is what you hear about now, the rapid test that you can do. What's interesting about that one is that usually this is the one where it has a lot of false negatives. So if you get a negative test back, you don't know if you can trust it or not. In this case, this is the one that turned up positive for the Ohio governor, followed by a negative molecular test. And my understanding is they're looking into the why behind that as we speak. In the meantime, I think it's a good thing that they're quarantining for 14 days just to be on the safe side. But out of the 3 tests, the molecular test is the best. The antigen test is the rapid test that people hear about, but has a lot of confounding variables. And then the last one that we haven't talked about yet is the antibody test. And that one tends to have more false positives and does not tell you anything about active infection. So if you're symptomatic, the test that you would get would be the molecular test or the antigen test, hopefully more likely the molecular test. And if you've had symptoms in the past and you just want to see if you've been exposed to it at some point, then you would do the antibody test to see if you have the antibodies to COVID-19.
All right, we know we want that answer immediately, but that can come with some caveats as well. And Dr. Alexander, we've talked before about Remdesivir as a COVID-19 treatment, and now we're hearing that researchers are looking at whether it's more effective in combination with other drugs. What are you hearing?
Yes, so we've been using Remdesivir now for the past couple of months in the treatment of severely ill patients with COVID-19 that are hospitalized. And it has cut down on the number of days a person is admitted to the hospital by about 4 days. They are now doing a phase 3 trial looking at this particular drug, Remdesivir, in combination with interferon beta 1A. Very fancy drug name, a drug that is currently used for multiple sclerosis and has antiviral and anti-inflammatory properties. So they're hoping that those properties, in combination with what we already know about Remdesivir, will decrease hospital stays even more. And they're looking at this again in those severely ill, those requiring supplemental oxygen, have had an abnormal chest x-ray, or are requiring mechanical ventilation. So those are the people that are receiving this drug. It's randomized, double-blinded, placebo-controlled, so not everybody's getting the drug. And they are in that phase 3 stage of seeing if it's going to work or not. And we're hopeful that we're going to have some results this fall.
Oh, very good. All right, as we end our time here today, is there anything else, Dr. Christie, that you'd like to add?
Yeah, just, the norm. Stay safe out there, everybody. Yeah. I mean, it's harder and harder to stay away from folks. You want to be around people. We have that COVID exhaustion and that COVID fatigue. And, just if you are going to have tiny gatherings where you see somebody, just keep your distance, wear your mask, and as school's approaching, just get your kids ready.
Absolutely. Some of the most valuable parts of our newscasts are when, Dr. Alexander, you grace us with your knowledge and answer our questions. Thank you once again for joining us.
Thank you so much for having me. Have a wonderful weekend.
You too.
All right. And a reminder, you can rewatch this interview and all of our previous ones with Dr. Alexander online at WCTV.tv.